This is my Mod 2 video for 6520. The foot and ankle impairment that I was given was medial tibial stress syndrome, better known as shin splints. The inhibitory technique that we would use or could use could stem from a tight calf muscle, the gastroc and the soleus. So the first SMR technique we're going to use is a foam roll in the calf. You could do that a couple sets, 30 to 60 seconds. The next technique that we would use, SMR technique, would be to release the posterior tibialis that lays right in here behind the tibia, that's deep to the gastroc and the soleus. And I'm using just a roller ball. You can use a lacrosse ball, any sort of a hard roller surface such as a ball, and we're going to just roll it similar to foam rolling to isolate the posterior tibialis. From then we would move to a lengthening technique. For this, the first technique I would use would be just a simple runner stance, having the leg to be stretched, knee fully extended, heel to the ground, front leg slightly bent, and just lean into the stretch. There again, stretching the ankle complex, gastroc, and the soleus. The next stretch that I would do, lengthening technique, would be a very similar stretch, but release the knee, go in the slight extension or slight flexion with an internal rotation, and then stretch, trying to keep the ankle on the floor. For the activation techniques, an item that we could use would be a calf raise. You could do it body weight or weighted with, you want external rotation as you perform that. Doing 3 to 5 sets, 8 to 12 reps. The next technique that we could use, activation technique, would be to lie on a flat surface using some sort of a stretch band and hook it over the foot and do ankle pumps or toe pushes to strengthen that posterior tibialis. To integrate this, a great exercise to use is what I call a balanced reach. It's done on one leg, balance on one leg, slightly forward bend, and then imagine a half clock face on this side, so you'd reach out 12, 1, 2, 3, and so forth.